How does Barrett's esophagus affect pregnancy? How does Barrett's esophagus affect pregnancy? This is an important question for many expecting mothers. Barrett's esophagus is a condition that arises from long-term gastroesophageal reflux disease. It involves changes in the lining of the esophagus, where normal cells are replaced by cells similar to those in the intestine. While this condition carries a slight increased risk of esophageal cancer, it requires careful monitoring. During pregnancy, many women experience gastroesophageal reflux disease due to hormonal changes and the physical pressure of the growing uterus. Increased levels of progesterone relax the lower esophageal sphincter, which is the valve that keeps stomach acid from flowing back into the esophagus. As the uterus expands, it can push against the stomach, leading to more acid reflux. This can worsen symptoms like heartburn and regurgitation, affecting comfort and quality of life for pregnant women. However, Barrett's esophagus itself is uncommon during pregnancy and does not typically develop or worsen because of it. This condition usually results from chronic and treated gastroesophageal reflux disease over a longer period. If a woman already has Barrett's esophagus before becoming pregnant, the main focus is on managing gastroesophageal reflux disease symptoms to prevent further esophageal damage and monitoring for complications. Pregnancy does not directly influence the progression of Barrett's esophagus, but the increased reflux during this time could potentially worsen symptoms. For those with sensitive stomachs, irritable bowel syndrome, or colitis, managing gastroesophageal reflux disease and Barrett's esophagus during pregnancy requires careful attention to diet and lifestyle. To minimize acid reflux and digestive discomfort, avoiding trigger foods is essential. Eating smaller meals and not lying down soon after eating can also help reduce symptoms. Medical treatment options during pregnancy may be limited but can include antacids or medications considered safe for pregnancy, always under medical supervision. Barrett's esophagus does not usually impact pregnancy directly, but the gastroesophageal reflux disease that may worsen during this time can increase discomfort. It is important for women with Barrett's esophagus to work closely with their healthcare providers to monitor their condition and manage symptoms safely throughout their pregnancy.